Welcome to the FLOM Leadership Podcast Series, generously sponsored by CooperVision. I am Megan Hunter. Today we are going to discuss becoming a leader amongst many. How to become a leader in a clinic with multiple doctors or no defined hierarchy. I have two great guests to discuss this topic with us today. Dr. Jason Koschmeder and Dr. Daniel Bastian. Jason completed a residency at the Albuquerque VA Medical Center and then joined the Eye Associates of New Mexico in 2014, a multi-center, multi-doctor OD-MD practice. He is also one of the residency supervisors. Dan completed a residency in ocular disease at the Boston VA healthcare system. He then joined the New England College of Optometry faculty in 2014. In 2018, he became the clinical director and residency director of the Lynn Healthcare Center. Let's start by just talking a little bit about your practices. Jason, do you want to start?
Sure. Eye Associates of New Mexico, we are about right around 60 doctors strong, about half ophthalmology and half optometry. And we are one of the largest practices in the United States, largest private practices in the United States. And we're only in New Mexico, mostly in Albuquerque and the Santa Fe area.
How many locations?
In Albuquerque itself, we have right around five locations, and then two in Santa Fe.
Great.
And we kind of up in Farmington. Yeah, so right around 11 locations now.
That's great.
Yep.
And Dan?
Yeah, I'm a full-time associate professor of clinical optometry at NECO, and my clinical responsibilities, I'm the director of vision services at Lynn Community Health Center's eye clinic. The community health center has many different departments, including dental and primary care and infectious disease, and I help to run the eye clinic there. As part of the eye clinic, we work directly with the NECO interns. We have fourth year, third year, and second year NECO interns. And as mentioned, I'm the program coordinator for our residency that we have there in oc disease with an emphasis in community health.
Great. So you both interact with a lot of people every day. You are both at practices that you started very early in your careers. How did you establish yourself as a leader, a potential leader, in the beginning?
Practicing with so many other doctors and with ophthalmology, it's all about practicing evidence-based medicine, right? Doing what we learned in school, practicing it to the best of our knowledge, not trying to be gung-ho at all. It's really about working with the team, working with other optometrists and with the staff, and also with ophthalmology.
Yeah, and based on my experience, when you join a faculty, and there's quite a number of seasoned faculty members and you're a young leader, you really just try to work to kind of carve out space for yourself. You want to focus on a lot of the little habits, such as listening a lot more and arriving and being present and present early for a lot of things to develop a little bit more of the smaller habits that you can then grow. And participate in a lot of training, which I think young leaders have to do when they're amongst other leaders. At the health center, there's a lot of medical directors of different departments, and it was just really important for me to learn not necessarily to be a manager, but more of the leader, and to have a vision and to slowly be patient with that vision over time, getting more opportunity as years went on to express myself as a leader.
That's great. Did you have any obstacles in the beginning that you had to overcome?
Yeah, I think when you have a certain skill set that you believe in, whether it's passion or grit, you have to learn to be able to control yourself, and you have to work on your emotional intelligence and your stability. Certainly you're going to be put in a lot of unique situations. And as a leader, you need to be able to control yourself and express yourself so that everybody feels safe in those environments, and I think that's really important. That certainly can be an obstacle to work on when you're feeling a certain way to develop those skills. And also just to be patient with yourself. I think a lot of young leaders, amongst other leaders, they immediately want to do more and take on more. But it's really important to develop your vision and be patient in those situations. And that can be an obstacle if you try to push and rush too much.
Yeah, I always feel like showing people what you're capable of and not telling them is also one of the best ways to, when you're newer and and starting off especially.
Absolutely.
And what about you, Jason? Anything you want to add?
I think a big obstacle is, just trying to fit into the culture. First year in school, and I wasn't a traditional student myself. I was in nuclear medicine technology first, so I went to optometry school in my early 30s. So I was kind of used to working in hospitals, going back to school, and then we're in school, we learn how to do things one way, and then a residency another way, and then you come into a practice and you try to fit in at that practice location yourself. So I think that is one obstacle for all the new grads, is trying to find themselves in the practice.
For sure. How many optometrists were there when you started?
Probably right around in the low 50s. Now we're probably in the upper 50s. So, we're in the last 10 years, we've been pretty constant in the number of providers for the state.
Okay.
Yeah.
All right. I always feel like one of the best ways to show leadership is to just lead by example, to our colleagues, to our staff especially, to even those above us. So why don't you go over some ways that you've done that in your career?
Yeah, I think when being a leader to students and working in a clinical environment, it's really important to show leadership as a provider, leadership as a colleague to your peers, and leadership to them in the profession. I think that's really important to set good examples for them to follow, because students are really paying a lot of attention in that environment. I work with a lot of students there, and I think that learning, being a part of leadership training helps to develop those skill sets, because you don't always have those early on to be able to just trust in yourself, but knowing how to run a meeting can be a really good example, in terms of setting a time, giving people tasks during that meeting and allowing them to feel a part of it. Those, I think, are nice skills that help people express themselves as a leader and being an example of it, rather than everybody feeling like you have to do everything and you're the one that's controlling everything. You learn that that's not the best way to lead. So.
Yeah, try to, just by example, trying to do what you can do. Sometimes you have to step up and show people, what is important and what needs to be done, and to be the first one to do it. Sometimes, we do extend ourselves a little bit too much and outside of our comfort zone. But as long as we're still taking care of ourselves, that's part of the growth and development and practice, right, of being an optometrist. Is just learning ourselves and trying to show their younger doctors what we can do. Also,
yeah, I think not being too afraid to fail, not to step on your words, but when you're being the first one to try things, it can be scary because you're worried about failing in front of people, especially when you're in a leadership position.
Yeah, for sure. And I would say, especially when you're working with ophthalmology, sometimes I too work with ophthalmology, and being confident to show your leadership abilities when you're in kind of their world takes some time to get used to, for sure. For sure. You both work with a lot of people every day, huge groups. So I felt like sometimes I learn a lot just in the casual conversations with people that I work with over coffee or lunch. How have you learned about leadership from people that you've worked with? Do you have any examples of that?
I think what I've found when working with other people is having that shared vision is really important. At the Community Health Center, we believe in providing quality care regardless of people's ability to pay. And as a leader, I continue to remind everybody, and we go back to that vision. And when you have people, a lot of different people that you're interacting with, when you have a common vision, it really helps to bring everybody together, and it allows them to know the purpose to which they're trying to do. And so I just try to often remind everybody about what we're doing and why we're doing it, which I think can be very helpful.
Just listening, so much listening and answering questions, taking the opportunities. I was on our board of directors for 3 years. 3 years ago, I was the end of my term, and just walking with our CEO at the time, the founder of the company, just to know the culture of the company. Taking walks with them, and then our optometry director, the phone conversations with them, discussing issues, what's on my mind, and discussing with them, and then I try to do the same thing, with my residents. Also, I just talk to them, try to balance in being in private practice and insurance and getting paid, and then listening to our billing coding specialist. What are the steps we have to do? What do we need to do? And trying to balance all these things of a private practice, to keep our doors open and still serve the patients to the best that we can. And then in my clinic itself, I'm the one doctor that's there every day of the week. And we have one cataract surgeon there. We have 2 other doctors that rotate through there. But then a pretty big staff considering the size of that clinic and how many doctors are there per day. And just talking with the staff leaders also and the management.
Yeah, for sure. So you went for walks with who did you go for walks with?
It was our CEO, the founder of the company.
Okay.
Yeah, so it was really excellent, Dr. Weinstein. Just the his vision for the company, throughout the years, and what he sees us doing now, it just kind of trickles down throughout the culture.
Yeah.
Of the company.
And when did you have the opportunity to go for walks? Like in the middle of the day, or did you do that outside
on the weekends?
of work?
On the weekends,
On the
outside
weekend?
work.
That's nice.
Okay. Yeah, that's great. I think a casual, a more
Yeah.
laid back environment, you can definitely have a free conversation about what everyone is thinking.
Right.
So that's amazing. I should probably do that with my boss. So did you have mentors at all going through?
I did, absolutely.
Okay.
And even to this day, the chief medical officer at the community health center is a major mentor to me. Somebody who I think, again, what Jason said is listening is something that really, when you're a leader amongst other leaders, you have to do. Those that don't listen often veer off. And so, yeah, I was mentored by the CMO. I've been mentored by past deans and at NECO and other senior faculty members at NECO. And it's really important because, you have certain skill sets, but there's certainly a lot of things that you need to learn to navigate. And there's certainly, cultures to be aware of, and things change over time. There's a lot of differences amongst the way things used to be to the way they are now, and you need to be able to pay attention to that. Certainly sometimes you can have blinders on and not realize it, but by having mentors, they hopefully help to guide you. I feel like mentors can sometimes be a cheat code in leadership because they're there to help kind of guide you in many ways and take your strengths and support them and allow you to be aware of your blind sides and your blind spots because, we all have a lot to learn and things to be aware of, and mentors can help you with that, a lot.
So when you're being mentored and you're asking for advice, sometimes you might hear some things about yourself that
Absolutely.
you don't want to hear. So how have you turn that into something positive and kind of not let it be something that makes you feel bad about yourself?
I think it can be really hard. Yeah, 360-degree feedback is it can be challenging, but it's important for growth. I think a lot of leaders have really good intentions, and they should in the positions that they are. I know I do. Like when I go to work, whether it's being a clinical educator or whether it's running the department, I'm there for reasons that I really believe in. And sometimes you can lose your way at times, and you ask your mentors help to bring you back and remind you about what was your driving force, because life can be challenging and stressful and things happen, but you don't want to lose track of who you were that got you to where you need to be. And I think sometimes young leaders amongst leaders can lose track of themselves, and mentors help to remind you that. It is hard to hear, but it can allow you to bring forth what was most important, whether it's your passion for teaching and your love for teaching or patient care. All those need to not be lost at times, and feedback can remind you of what's important.
Yeah, I agree. Have you had mentors going through?
I do, yeah. And I don't think mentors are always like a defined relationship where you ask someone if they're your mentor. I think it can be someone that you look up to also, and I certainly have those now and throughout my career. I would definitely consider our director of optometry a mentor to me. I mean, how long he's been with the company and his attitude and how he treats all of us fairly, and his direction for the company. So that's one. And then also the chief of optometry, where I went to through my residency. Also, I still keep in contact with him. Just the things he's doing through academy and for optometry. So, yeah.
That's great. Do you mentor people now yourselves?
Yeah, certainly as a residency program coordinator, I love to mentor my resident, and I've been able to provide a lot of feedback in terms of the direction they want to go in. Oftentimes they do a ocular disease with an emphasis on community health because they have a passion for it. And in New England and Boston specifically, community health is really strong and secure, and it's not that way in terms of having vision services across the country. And so we certainly help to mentor other residents in terms of going into community health practice and what that's like. My current resident is right in Ohio at a LeBron James Community Health Center, and she's the first optometrist for them to open up, and it was great to be able to mentor her through that experience, and it's not easy, and now she's a leader on her own, and I love mentoring residents. It's a very rewarding experience.
Yep.
And I am a residency coordinator for the practice, and we have one resident at a time. This is our 7th resident, the 5th resident since I've been the coordinator. So it's really fun working with them and trying to bring them up through the program, so that they could work anywhere. It's great.
Yeah, and they're ready for anything, for sure.
Yeah.
I think that's all of our goals with residency training.
Absolutely.
So we definitely, that's an obvious role, right? We're going to mentor our residents, our students as well. Any roles that maybe were a little less obvious, where you were clearly in a mentorship position, where you've had an opportunity to mentor staff or?
Yeah, I had an opportunity where we didn't have an optician in the practice for a little while, and we had some optical assistants, and now that we've gained an optician back, I realized that over those years I was able to mentor that optical assistant, and she's a young lady who works really hard, has an incredible work ethic, and is very dedicated to what she's doing, but didn't necessarily have any background in it. And now we've created a bit of a career path for her where she's going through a bit of an apprentice program. And I just look back on that was a great opportunity where I was able to mentor her through some tough years because we didn't have an optician. And now that we do, we're really kind of gearing her and guiding her in the sense that this would be a great career path for you. You've done so many of the skill sets. And I didn't realize that. It kind of just came on organically. She was helping out and a full-time employee, but now we have her on a career path, and now she's excited and getting hours under herself, and she's going to take an examination to be able to go on to an opticianary career. And it wasn't exactly it's not exactly optometry, but to be able to mentorship somebody towards a career who didn't necessarily have that path before, I think was very exciting.
Yeah, it's nice to see people finding passion and bettering themselves.
Absolutely.
And getting a better life for themselves.
I would like to think that I've mentored others. There are some younger doctors in the practice that have not been through our residency program that hopefully they kind of look after what I'm doing, but definitely for the staff as well, the new staff and some of the staff that have started 10 years ago when I started and seeing where they are at the practice. I feel that's really incredible working with them as they've kind of built up through the practice is so rewarding. The different management and administrative duties they've taken on throughout the last 10 years.
Yeah, I've had a similar situation in my workplace where someone started after me, another optometrist in our department, and she kind of initiated it, have lunch with me, and now I consider her definitely one of my mentees, but I learned from her as well, actually. So we've both been there now for a long time, and we're both able to help one another, use our own strengths to help one another. So that's good. So you're in these huge practices. How do you make yourselves very, open, willing to answer questions? Because I'm sure you're both very, very busy, right? Like your practices are very busy. So that can be a stressful situation when we're in a busy clinic and we're just trying to get through the day. How do you make yourself welcoming to questions from others that need help? The staff, the front desk, other doctors.
That's a great question. I think that early on when I went through some leadership training, such as FLOM, I learned that everybody has different communication styles. And so one of the exercises at a staff meeting was let's go around and identify our different communication styles. Because in clinic, specifically, I have a very direct communication style. And, because you're so busy and you're putting out a lot of fires and you're making a lot of decisions, you tend to speak very direct. But other individuals who maybe speak a little bit more charismatically can sometimes find direct communication a little bit abrasive or off-putting or intimidating. And so by having that exercise, we simply opened up that we're all different in terms of how we communicate with one another, and acknowledging different communication styles simply took the burden off of, well, that's not necessarily anything against you personally, or the person's not upset. That's just the way they prefer to communicate when in this environment. And so it was also helpful for people who were charismatic and maybe a little storytelling in their communication to realize that if somebody asks a very specific question, it wasn't because they didn't enjoy listening, it's just they kind of wanted to get to what needed to be said. So I found that exercise to be very helpful, and working in that environment can be really important.
Yeah, for sure. Yep. Anything you'd like to add?
I think just working with the staff and just taking time to learn about them, their characteristics and what they need and how they need to hear things. That it's not really about me, it's really about them. And so a lot of times I take a lot of time just to process things. I do better if I can think about it for a while. So if someone comes to me with an issue, I know I might seem really busy, but thinking about it, and then I'll come back to them and try to give them the time to talk to them.
Yeah, I think they definitely want our time.
Yeah.
I do sometimes eat lunch with them, or often, and just listen to what they're talking about, because a lot of times they have life challenges that I don't know about, or that I don't have myself, and so just hearing that, and I think it helps be to be a little more understanding when things might not be going exactly the way that we want in clinic, and to make sure that we're always being nice to staff, because that's very important for a happy clinic and a clinic that's running really well. So yeah, that's helped me too. So I think you both have done great things. I love that exercise that you had a meeting.
Yeah.
So you actually explained it to them so they understood, because of course we're all, I'm sure, very, very direct in clinic, because
it's the nature.
you have like 8 patients waiting. You can't really be very chatty without upsetting patients.
Right.
So we do have to be direct, but as long as they understand that is the way it is, and we can talk more later at the end of the day. Do you kind of do a wrap up at all with students? I'm sure.
Yeah,
right?
students get feedback towards the end of the day. Huddles, we call them, both before and after at the end of the day. With staff, there's regularly scheduled meetings, and I'm a part of even reception meetings. Even though I'm the director of the eye clinic, I love to be present, just to give them an opportunity to know that I'm listening and know that I'm present and hearing. It does tend to maybe get overwhelming, and they have a lot to share, but it's worth it at times. And so yeah, you just try to create as much space as possible, and to know everybody's working hard, and this is part of their daily living and what they're doing, and checking in is nice. So.
All right. Do you guys have anything else you'd like to add about working in these big clinics and being a leader to the people you work with and the profession?
Bring something positive to the culture that you're in. Try not to be a liability or be negative. It's the biggest thing we can do, right? Try to fit in, but try to be positive.
Yes, absolutely.
And I think little habits go a long way, and to be patient early on when you're a young leader amongst many leaders in a big clinical space, it's important to be patient, be a really good listener, and soon you'll develop your time if you work on these skill sets.
Well, it was great talking to both of you. I think that our listeners will definitely learn a lot about from your experiences and your knowledge on leadership and just on optometry and clinic and working in busy clinics. It was great to spend time with you. And to our audience, thank you for joining us on this FLUM Leadership Podcast series. This is part of our FLUM Leadership Academy initiatives, and if you would like to learn more about the FLUM Leadership Academy, you can do that by searching FLUM on our Academy's website. Thank you.
Thank you.
Thank you.